Can everyone hear me?
Yes, this is Cheryl. I can hear you, Dr. Khan.
Okay, good, good. Well, I do not see your picture. Is everyone able to see Cheryl and myself, or just me?
I think we're just maybe. Oh no, we're seeing both of us now.
Okay, good. I'm not able to see you, but if everyone is able to see Cheryl, then I think we can absolutely continue. So credit goes to Alicia and Cheryl and everyone else. Lori, my office manager. We tried for almost an hour. We were trying to get this worked up for an hour or so, but we ran into some hurdles. But many credit goes to Alicia for setting this up. So thank you very much. I appreciate it. And I'm very grateful to you for getting our guest Cheryl on. I just want to kind of get a feedback. Is everyone able to see Cheryl and myself? Is everyone able to see Cheryl and myself? Yes, we see both. Okay, very good. All right.
Great.
So, Cheryl, let me ask you a few questions. Now, this is very interesting in a sense that, Cheryl and I have not talked about what we're going to talk about. This is an interesting way to ask my patients because I look at, and nothing excites me more than me talking to the patients. And this is what I was talking about earlier, where they are so well read and so informed. I could have them get a marker and a board and get up on the board and actually talk and give a lecture on breast implant illness. So let me ask a question, Cheryl. Before you came in and saw me, how convinced were you that you had breast implant illness?
I was pretty convinced from the research that I had done through the various breast implant illness social media sites. And I have to give a lot of credit to one of my daughters who really led me there because she had been telling me for months that she was suspicious that the various problems I was having were breast implant illness. But I really thought some of my other doctors would have brought that up along the way. But the more I read, I was pretty convinced, and then ran across your videos on YouTube, and that kind of convinced me that you and I needed to have a stronger connection, and for me to get you to kind of evaluate my medical history. And Dr. Khan, I think I don't see you anymore, so I'm not sure what happened to your video. I did see a question come in the chat, so hopefully we'll get Dr. Khan back here in a second. Um, so to answer Tracy's question about how long I had my implants, I got my implants in November of 2012. My symptoms started um, about 14 months after I got my implants, and progressively just more and more breast implant illness symptoms developed over the years. And then I explanted on October 29th with Dr. Khan, 1 week shy of having my implants for 7 full years. And it looks like Dr. Khan is back.
Okay.
Are you able to hear me, Dr. Khan?
Yes, yes.
Okay.
Now, there is, yeah, okay. So, how certain were you that you were going to rebound and essentially we were going to normalize after you had your explant surgery done?
I was very confident and had a lot of faith that the joint pain that I was having, I suffered with a lot of skin rashes and allergies that were either metal allergies or chemical allergies. And I was I was confident going in that I was going to feel better. I wasn't sure that it was going to be immediate, but I was sure that over time it would happen.
Sure. Now, please tell us what were your signs and symptoms and how did it all start? And like, what was going through your thought process when you first heard of breast implant illness?
Okay. My symptoms started about 14 months after I got my implants. Started with skin rash that was originally diagnosed as a nickel allergy that they said was also not just contact allergy but systemic. And then I continued to develop gastrointestinal issues. My skin allergies became worse over time. The 5+ years that I had been diagnosed with these allergies, I've been using oral and topical steroids. So nothing was really, even if I was restricting my contact to some of these items and even to certain foods, it wasn't curing the reaction. It was just getting worse, and I was just covering it up with this, steroids. And it got to a point, even with the steroids, weren't taking care of it. And I thought there has to be some other solution to this. And that's when I started looking into breast implant illness and hearing from a lot of these other ladies who are on the various Facebook and Instagram sites. We all have similar stories, similar allergies, same journey. We've been to many doctors. We've spent a lot of money on prescriptions and office visits and tests only to be told, it's something, or maybe they don't know what it is. And so I just had to kind of go on faith that this made sense after looking at, and talking with you, Dr. Khan, about all the various symptoms of breast implant illness. And I believe I had 31 out of the 50 on the list. Things that I really wasn't even aware of that were breast implant illness symptoms, like recurrent UTIs. I had no idea. I didn't know why I was getting recurrent UTIs, but I had had those over the past several years as well. Did I answer, I think, all of what you had asked me to address? Are you able to hear me, Dr. Khan?
Yes, I can hear you just fine. Yes.
Okay, great. Did that answer?
Yes. Okay. Now, what was if I may ask, what was the most important part or the most significant aspect of the consultation that was the gist of the whole consultation for you?
Mm-hmm. Well, we first did a phone consultation, and I think the fact that we went through and you asked about all of my signs and symptoms, and because of your belief and your advocacy in breast implant illness, you were pretty convinced that what I was going through was breast implant illness. And so for me, kind of the next step was to come and see you in person, so that we could make that further connection and have you look at some of the actual medical documentation that I had gathered. And so from there, it was a very easy decision. Even before I was there in person, I knew I was going to book my explant with you. It was just coming to meet you in person so that we could, talk a little bit more and then schedule that surgery.
Sure. Now, I will tell you, it's very important. So there are a lot of consultations that are being done. There's nothing like going out of your way and making that effort to go talk to your surgeon face to face. I find that's a very important part of the informed consent. Not only is the face-to-face consultation, looking at the facility, if it happens to be right there, to kind of doing your due diligence and the homework to ask the questions and to see, and ultimately this is what it boils down to, the sincerity of the doc in regards to what is breast implant illness and how convinced and motivated the doc is in regards to offering that entire capsule and the implant that needs to be removed. And because that is ultimately what dictates how and what the recovery is going to be like. So now let me ask you, how was your entire surgical experience like? What was your post-op? What do you remember waking up when you got done with the surgery?
Sure. And I do want to comment when you said, it's important for patients to see the surgery center. And I know many of your patients that have commented, not many surgeons take their patients on a tour of the surgery suite. And that was something that I felt was, very personalized, and the personalized attention, not just to me, but to also my husband, and making sure our questions were answered. So that, as far as the post-operative experience, I remember, waking up in recovery, having those first sips of fluid and pain medication. My pain was, I wouldn't say minimal, but it wasn't severe. But the pain medication that I took made me comfortable. I woke up very easy. I traveled from out of state to see you. So
Yes.
I was staying at the hotel that's next to your office. And so we were back. I was the first case of the day. So I was at 8 a.m. or 8:30. And I believe we were back to our hotel by 1:30 or 2 o'clock in the afternoon. Had a little rest. I was able to walk, down to like the common area where they serve food for dinner, and walked the halls in the hotel for exercise, because you were a big proponent of getting up and keeping moving right after surgery. And I felt very, very well to do that. And the pain medication kept my pain under control. I wasn't nauseated. I didn't throw up. I didn't have to have drains, which I think speaks to how meticulous you are with the en-bloc procedure. So many women have to have drains. And I know you've spoken about this, but you'll put them in if they're needed, but many times they're not. A good compression bra, I did feel like, made me feel more comfortable physically after the surgery as well.
Right. Now, if I may jump in and I say, the time it took for the surgery, I believe it was around 4 hours. Normally it is plus minus half an hour, but I believe yours took 4 hours, if I do remember correctly. Now, I just heard another explant specialist doing the end block resection plus a lift in 2 hours. What is your take on that, Cheryl? And again, as a patient who has done a lot of research, and who I would say is an expert when it comes to breast implant illness, and who understands this disease, who has experienced it. So what is your take on a 2-hour end block and also a lift?
With a lift? Well, I had a lift with my implants in 2012. And so I know what that recovery is like. But after doing the research on really what it takes to do that delicate dissection that comes with an end block, I really don't think that 2 hours would even be enough just for an end block, let alone what you need to do for a lift with all the extra incisions and skin removal. I would be questioning what exactly is getting done in 2 hours. I would say if someone is telling a patient that they can do an end block with a lift in that amount of time, I would say do some more research and really question that doctor some more. I know from our conversations, and as delicate and the time that you take to make sure everything is dissected as perfectly as possible, it would be hard to do in less than 3 hours.
Right. So that is very true. So I've talked to a lot of my other plastic surgery colleagues. Yeah.
Oh, go ahead.
Right. So I'm sorry, there's some resonance going on. So I totally agree with you. In order to do the dissection right, in order to put no tears into the muscle wall, no tears into the capsule, which inevitably will cause the leakage of the implant. If it's a ruptured implant, the silicone into the chest wall, it has to be done in a very sophisticated, very meticulous manner. And that's why I will tell you, on average, I only book 3 cases in a day, starting off at like 8:30 in the morning and finishing at like around 8:30 in the evening. 4 hours, 4.5 hours, sometimes 5.5 hours, depending on the length of time it takes for to do the surgery. And I will tell you, and I tell my viewers and listeners, that in order to do just a lift alone, that normally takes 3 hours in order to do, because the whole dissection and then the suture repair, i.e., of the respective layers and complex closure. That is a very involved process, and you cannot be rushing through the surgery. Now, Cheryl, question for you.
Mhm.
When did you start reacting and responding post-operatively? Like, how did you start feeling and reacting? Like, when did you feel like you had benefited or you were benefiting from the
Mhm.
surgery?
Well, the minute I woke up, I could breathe better. So it starts from kind of that minute one. The next morning, when I woke up, I wasn't foggy headed. I didn't realize how much of a brain fog I had until I didn't have it. To the point that I even found it difficult to sleep the second night because my mind was so active. Um, and then my skin cleared up on that second day as well, and has continued to stay clear. I've had my family members even say my complexion is completely different now. It's back to what it was before. I had actually forgotten what my complexion looked like over the years because I've been dealing with these skin rashes
No,
forever. And it
absolutely.
was,
I remember, Cheryl, when I walked into the post-op the
mm-hmm,
first day, the first time that I saw you post-op and I saw your face and your husband was right there. I'm like, wow,
mm-hmm,
that is pretty
mm-hmm,
dramatic. And
yep,
I will never forget, it was one of the most dramatic reactions to the explantation that I've seen. And I will tell you, even when I saw you today with the
mm-hmm,
skin texture, and I know you texted me a picture of before and
mm-hmm,
after, it was
I did.
extremely, like the before and after pictures were very, very convincing. And this is very similar to the many thousands and tens of thousands of pictures that you get to see on the ladies that have explanted and how their face and how the rashes and the rest of the edema, the swelling on the
Yep.
face basically subsides for the better, and where and what the face used to be like before the implants were put in. Now, what are the other, what were the first few other changes that you saw in addition to the rash? Sorry, I jumped in because I wanted to jump in and fill in and say how dramatic the response that I noticed as soon as I walked in, I saw you.
Mm-hmm. Yeah, the skin rashes for sure. It was the biggest win for me. Not feeling that weight on my chest that I really didn't know was there until the implants were gone. That you don't realize that you're not able to take a huge deep breath. I can exercise more easily. I'm sleeping better at night. I've been dealing with insomnia for a couple of years. And so I'm able to sleep much better at night. I've had intermittent spells where I'm waking up in the middle of the night, but nothing like it was before. Um, I had leaky gut, and I've been taking all kinds of supplements for a few years to treat that. Things are more back to normal with my gut. I still have a little bit of a reaction to gluten and a few other foods, but I figure that may take a little bit more time for my gut to heal. So I'm going to be patient with myself on that. I've not had any UTIs because I'd been battling recurrent UTIs, and the brain fog is tremendously improved.
Sure. Did you have any? So this is what I find. If you talk to the ladies that walk in, almost always they get labeled with this fibromyalgia. They are almost always sent to the rheumatologist. The workup they have
Mm-hmm.
somewhat positive lab workup. They're almost
Yep.
always sent to the psychiatrist. They're told that this is all in your head and that the breast implant illness is not even
Mm-hmm.
a factor or a reason
Mm-hmm.
to be looked into because they've been determined to be safe. So just today, as you and I talk, one of the very prominent members sent us on Facebook a lady that has been in the ICU for 8 weeks, who finally, after 8 weeks or 9 weeks of workup, has had an extensive, what I would call over $1 million, if I were to estimate, if not more, labs. Every single aspect of the lab workup has been done. This patient went and underwent, uh, you know, explantation. The question becomes, the entire hospital is not convinced that this is breast implant illness. So, Cheryl, what do you have to tell what do you have to say to the group of docs, plastic surgeons, about breast implant illness from what the way you know and the way you
Mm-hmm.
experienced, and how you would tell the world, so that anyone who's listening, especially the significant others,
Mm-hmm.
the patients themselves who have a big question in their mind, is this an investment that's worth my time and effort
Mm-hmm.
and the money? Why would you drive 6 hours to get the surgery done? Meaning,
Right.
what would you tell, going back to the initial question, what would you tell the
Mm-hmm.
docs, the primary care doctors, the rheumatologists,
Mm-hmm.
all the doctors who saw this patient? What is breast implant illness? Is it real, or is it just in your head?
It's definitely not in my head, and it's not in the tens of thousands of women that I have read stories about on social media. Um, we haven't all gathered in a room and said, let's come up with this group of complaints and blame it on breast implants. Most women will say they never considered it being their implants. I was one of those people, but if there's nothing that medically or evidence-based that can explain what's going on with a patient, you have to believe that if the implants are the underlying factor, it's got to be worth taking a risk or a chance of having those removed and seeing if you get better. And that's what gave me a lot of confidence, hearing from women who had gotten better, some immediately, some over time, some still struggling. But, I had to believe I'm somewhere in that path, and I'm going to just believe that I'm going to be one of those fast recovery folks. But more, if you look at and you study what has been done or not been done with breast implants by the FDA, more studies need to be done. And I know, Dr. Khan, you probably have some things that you could say from your medical experience of what you knew about breast implants, and why they were dangerous in the 90s and why they're still dangerous. But anytime you put a chemical or a foreign body in your body, there's going to be a reaction. May not be immediate, maybe over time, maybe some people are lucky to never have a reaction, but those that do, it is very real, and you have to believe, if you can't find an underlying reason for it, that it could be the implants.
Right, and I agree. And just to summarize for those patients, there's so many patients that I've talked to this within the last week or 10 days that just heard for the first time what is breast implant illness 2 weeks ago, a week ago. And they're learning, and they're literally doing their homework in the middle of the night, getting up, looking,
Mm-hmm.
talking to other Facebook guests, friends, and telling, and this is what they themselves have been telling me. Last week, I saw 3 patients consecutive back-to-back who presented, and I asked each one of them. One was 35, the second one was 37, and another one was 39, in that increment. And I will never forget, and I asked each one of them, just like I asked you, Cheryl, what is the likelihood that you have breast implant illness? And each one of them said 100%. And I said, again, being the devil's advocate, why do you say that? And they said, we have done everything else. And I just talked to this other friend who had this explantation done, who I was talking to. And she said, I was very curious, and she was upfront, and she said, I wanted her to go first to see if she was really going to rebound or not.
Mm-hmm.
And before I went and proceeded, because I didn't want to do something that was going to be that significant. And she was surprised that her friend, just like the many others, bounced back. And I say there is no test, as we all know, no lab workup. All the inflammatory markers and whatnot else come back negative. All the imaging studies come back negative. No rupture. Saline implant is intact. There is no fluid. There is no lymph node reactivity. All the rheumatological, endocrine, everything else workup is negative. But what is the diagnosis? How did you, Cheryl, do it? Pattern recognition, where you said, I have, and this is what I do. I look at the questionnaire that I have each and every single patient that comes, that checks the boxes, and I talk to them. And again, just by looking at the questionnaire, I get a sense of the intensity of what the breast implant illness is. And just like you mentioned, the first feeling that you said, where you could breathe better, the tightness of the chest, the way you were able to breathe in nice deep breath, That,
Mm-hmm.
along with, did you have, like changes in vision, like you mentioned, the brain fog, the skin rashes, and
Yeah.
literally every part of the body benefits as a result of the implants being removed. Now, can I ask you a direct question? Do you think,
Mm-hmm.
and this is what many docs say, and they tell me when I talk to them at a party, I was just at this Christmas slash end of the year meeting, and one of the docs, oh, you're the doc who believes in the breast implant illness. Or the other day, I was at
Mm-hmm.
another gathering, and they said, well, you must be very busy putting in implants. And I said, no, I only take them out. And then they ask me all the questions, and I explain and I direct them, and I tell them, no, this is very much real. And when they do look into it, they are very much surprised when they see the patient's reactions, because I tell all my patients, don't listen to me, listen to all the other ladies that have had the explant, that have, and just like you very well mentioned, Cheryl, how you bounced back, how your
Mm-hmm.
symptoms improved dramatically. Just, and what's amazing is, for someone who walked in and he was so determined that it was the implants and they needed to absolutely come out. And one thing that I always like to mention to my patients, not a single one of my patients, not a single patient that I've taken care of who has explanted with me has regretted removing the implants. And if anything, and I mention this to almost all my consultations, they feel so happy that they got the explantation done. They
Mm-hmm.
feel if they were to be given a chance and to go back, they would never have inserted the implants. And number two, if they were given a chance, they would have removed the implants sooner. And these same
Mm-hmm.
ladies, they lived in misery 10 years, 12 years.
Yep.
Another lady that I took care of, who had implants pretty much her whole life, was a rheumatoid arthritic patient on prednisone, and she had her implants from 1981, from back when Reagan got inaugurated. As you can imagine, 38 years. All
Mm-hmm.
these patients have been hurting, and they didn't know that, like you said, that there were other symptoms that you did not know were attributable to the breast implant illness.
Mm-hmm. Yeah, and I
Now,
forgot to add, Dr. Khan, I did suffer with joint pain in my hands pretty severely, and I was rheumatoid positive on a few years worth of labs, and my joint pain completely disappeared by the second day. Eventually, when I have my annual labs done, I'm going to have that rheumatoid factor drawn again, but I'm confident it's going to be much lower than it has been in the past. I never had any problems with joint pain or abnormal rheumatoid labs before I had implants.
right. Now, another follow-up question. So,
Mm-hmm.
if the FDA, if Lansing, Michigan, if the other docs are listening in, and hopefully they do you think this is a placebo effect, that all of this post-operative improvement in your quality of life, do you think this is coincidental, or do you think this is all like that you're that one person out of 10,000, or the 1.8% that the manufacturers put out? Do you think that this is a placebo effect or a coincidence?
No, absolutely not. I changed nothing else other than having my implants removed, and all those medical issues are reversed now. So I've done nothing else. And before that, I was spending lots of money on pharmaceuticals, office visits, labs, trying to figure it out, trying to cure it. Nothing was working. Had the implants out and changed nothing else, and I'm better. It's not a placebo effect. Absolutely not. I couldn't mentally wish my rash away, because if I would have been able to do that, I would have been able to do it long before now. But once those implants came out, the rash was gone. And that was the thing that was most visible for me, because it was always there. It's what people see first when they see you. I could hide the joint pain, all the other things you can kind of cover up, but certainly not your skin, because that's what everybody sees when you meet them.
Sure. Now, what I want you to do, Cheryl, is if you have a lady, nice young college student who's interested in getting implants, who's 22, for example,
Mm-hmm.
what kind of advice would you give her?
I guess first and foremost, don't do it. It's not worth it. Like you were saying, many of the women who explant, if not all of them, say, I wish I would have never done it. I'm one of those people. And the daughter that I credit to kind of leading me down this path, She found it because she was investigating to get implants for herself. And when she discovered it, that's what convinced her not to. So I think we need to keep our voices heard, and trying to reach out to young, middle, old age women, whoever's considering getting implants, to say, you really need to take a good look at these symptoms and what other women have been through. Is that going to happen to you? Not sure, but you certainly need to understand the risk. And most of us who are suffering or have suffered would say it's not even worth the risk. It truly isn't. If I could turn the clock back to 2012, I would have never done it.
I will mention a few things. As a surgeon, having looked and managed a lot of patients over the years with implants, exchanging of implants, because that's what every person who walks into a plastic surgeon's office, this inevitably happens. The old set of implants are removed and a new set are put in. Even patients who have had capsular contracture, there is no mention or discussion of not doing the explant only. And where in medicine, where in life can you have a patient say that one of the most personable surgeries that anyone can have done, where the explantation is done and the patients don't have a feeling of remorse, not even one patient. And this is pretty dramatic. And I said, from the many reasons that I say, in order to get part of the informed consent, to know what you are signing up for, yes, it is a real phenomenon. 100% it exists. Look at the tens of thousands of women who have basically come forward very bravely, just like you did, Cheryl, so that we can, at least if we can prevent one person or help one person to explant and understand this better, so that you have your perspective in this. My take on this is that, if someone who is 22, 24 gets them in, and we know they don't last forever, on average 10 years.
Right.
And if they live to an average American's lifespan of 82 years, she's going to technically, theoretically change them 6 times in her life, let alone all the other problems that it comes in with, let alone all the mammograms after 40 that she's going to be doing that may be obscured by the implant themselves, or the times where infection / other problems that the implants cause, let alone this breast implant illness that the manufacturers themselves have come forward and mentioned that 1.8 to 2.4% of the patients have rheumatological issues. Other studies, for example, the big study out of MD Anderson, where they commented and stated that there is a detrimental effect like scleroderma, rheumatological type issues, among the many other psych issues, and the tens of thousands of ladies that have come forward and posted, just like you did, Cheryl, the dramatic post-operative course, how they have bounced back. The 350,000 or so ladies that have complained to the FDA, which is a huge number if you ask, and I'm sure there are a lot more. So I say to you, and this is what you just mentioned, Cheryl, very nicely, that it is not worth it. It is not worth the trouble and effort to go through and ultimately pay a big price with the illness that affects literally every organ system of your body, which is very much real. And I say to the FDA, I say to the docs, and again with informed consent, just spend a day with me, a week with me in my clinic, and you will see patients that have been to the Mayo Clinic, that have been to the Cleveland Clinic, that have had all the tests that you can imagine being done. And all of them, just like this nice young lady in her mid-30s at a major hospital system here in Detroit, who finally ended up getting her surgery, and hopefully the surgery was done right. That will be the proof. And hopefully, I will make this prediction that it is only unavoidable. It is only going to happen where this is going to come out more and more, where more and more women I request to come forward and the plastic surgeons to discuss, so that ultimately we can offer the patients relief, so that we can tell them this pattern recognition, where a patient who has had this extensive workup, where when it is negative and the implants once removed and the patient bounces back, that's proof that the implants are not worth it. And that the surgery
Mm-hmm.
absolutely needs to be done right, so that the patient is given the patient is given her fair chance to bounce back and recover for something that really affects not only the patient but the patient's family, the daughters and the
Mm-hmm.
sons and the husband, the friends, the
Mm-hmm.
family members, and literally sucks the life out of these patients. And I see this every
Mm-hmm.
single day. Now, Cheryl, please tell us how yours were. If I do remember, they were underneath the muscle.
Correct.
How was your post-operative course when it came to, like, say, driving, when it came to
Mm-hmm.
starting to becoming more like active and kind of going back
Sure.
to your routine life?
Sure. Um, so I had surgery on a Tuesday. I went back to work the following Monday. So I just took the week off. Now I do work from home. So I have a desk job. So that did make it a little bit easier. It wasn't like I was having to commute back and forth to work. I didn't drive for probably about a week and a half. I know I had come back to see you at the 1 week post op visit, and gave it a few more days after that. And then I was able to drive. Still having a little bit of soreness, but I had started the massage regimen that you had recommended on the scars and the breast tissue to help with some of that soreness and tissue release. Um, as far as activity goes, the day after surgery, I went on a 2 mile walk at the mall
Wow.
there in Novi. So we went, actually, my husband and I went to lunch. We did a 2 mile walk through the mall. And then I just continued every day after that, walking more and more. One of my daughters and I take a 2.5 mile walk every morning. And so I think it was the second week we started back up on that regimen. So I really feel like I was pretty much back to normal by that second week, other than just still trying to get my range of motion with my arms above my head. But I've been taking it very easy. I'm the type of person that really tries to push myself to do more and more, like a lot of us women do, because we're relied on so much, to do for the family. But I've really tried to take it as easy as possible, and listen to my body. If something hurts, if I'm stretching to reach something on a high shelf and it hurts, then I don't do it. I give
No,
myself a little bit more time.
sure. Very nicely said, Cheryl. So normally, like, the walking helps with the breathing. It helps with improvement of the mentation. You obviously had a very nice garment that you got, so
Mm-hmm.
that it allowed for your chest to be under a mild to
Mm-hmm.
moderate compression, and then also a recoil, so that it will cause, as you move and twist and turn, that will be nice and secure, so there was no shear forces that was causing the skin to move on the chest. You release the endorphins when you walk. That helps with the pain control. It helps you maintain, breathe better. Remember the
Mm-hmm.
dissection that was done off of the chest. I don't want you to be in the room taking shallow breaths and kind of setting up yourself for what they call atelectasis, where the air pockets form and the lungs don't expand fully. And I find the recovery is better for those patients that are, and again, you're not running, just being active,
Mm-hmm.
and you basically that allows for a better recovery. You mentioned a very important factor with the massage. When you massage in a circular fashion directly over the incision, this helps basically calm those nerves down which were cut,
Mm-hmm.
in order to kind of that went haywire. These are the small nerves. Number two, it causes nerves to come in an orderly fashion towards the surface, so that you have nice sensation ultimately. And then number three, that irregular contour that you see of the collagen, that allows it to be laid down nicely, so that you have a nice aesthetic contour of the inferior aspect, which is where I make all my incisions. And these incisions, they heal relatively very well, because of the complex nature of the closure, and I use all dissolvable sutures, and they take up to 3 months, 6 months, and a year to truly settle. Now,
Mm-hmm.
what type of pain meds did you get post-operatively, and how did you kind of control your pain, with what tools, what modalities,
Sure.
what
Uh,
medications?
I believe you gave me tramadol, and I can't take Norco, so you gave me Percocet. And so I would say for the first 3 to 4 days, I was using both of those. medications, so alternating one every 3 hours. And then by, I think that Friday, I was really just using the tramadol a couple of times a day and didn't have to use the Percocet at all. And I was taking a leave twice a day.
Sure.
And so I could give up the Percocet fairly easily. The tramadol was just helping me be more comfortable more at night because the Aleve was taking care of the majority of it during the day.
Got it. Now, did I, and I don't remember this at the top of my head, did I request you to take Aleve or no?
Yes, Aleve twice a day.
Good, good. So Aleve, sorry, I missed that part. So the Aleve is a very good anti-inflammatory medication because sometimes when I do remove the capsule off of the ribs and basically the intercostal muscles, the fascia comes off because of the nature of the dissection. The Aleve is an anti-inflammatory. This is over the counter, 220 milligrams naproxen. So that works for 12 hours, one tablet every 12 hours. So you take one in the morning, one in the evening with the food. You alternate the tramadol with the Percocet, and then you time yourself so that you're always on top of the pain rather than chasing the pain. And between the walking and the post-op course, maybe the first or 2 days are the most involved. Then you only improve on an hourly basis, I find, as far as the pain and overall mentation. And when the surgery is done right, you bounce back very nicely. Any other points do you want to highlight, Cheryl? You want to let the viewers and the listeners know? I always say, we have a very broad audience. One of my, Lori, who's my office manager, asked me, who do you want, and Alicia as well. I say every single person is welcome. The significant others, the prospective patients, for example, patients who are interested in implants, patients who want to explant, patients who are getting an explant surgery by another surgeon who does the surgery right, just so that, we can make this a very meaningful, practical discussion so I can share from my experience how I, as a board-certified plastic surgeon, do what I do. Just to re-emphasize, I always send the capsule off to pathology so that they can look at it, make sure there is no malignancy, because any abnormal, pathologic, hardened, thick, indurated, abnormal tissue, I always remove. The other week, I removed a mass that I ran into while I was dissecting, and I sent it off, and it came back as ductal hyperplasia. Who knows that might have potentially become ductal carcinoma in situ or ductal carcinoma in general. So again, anything abnormal, and I do a breast exam and I go in making sure, and again, to answer one of those questions earlier, we don't want to miss a breast cancer or any breast mass that absolutely needs biopsy. I always send cultures for aerobic, anaerobic, and fungal, so that those cultures are sent, so there is no question that the biofilm that forms in and around or within the capsule, we're not missing on any indolent or basically hidden infection. I always mention, to my patients when I was in training and at the Carmanas Cancer Center, which is the #1 cancer center, we were doing these reconstructions. There was a patient that came in and she was in her mid-40s, and lo and behold, we found like a hyperpigmented soft tissue mass, and believe it or not, it came back as TB, which, to my surprise, this was sitting dormant in the patient's chest, and she had obviously traveled extensively overseas in the subcontinent, and that was the reason why, she had that residual / dormant TB. So for the patients, I always say, do your homework like you did, Cheryl. You came to me, I pushed you, you were always ahead of me as far as understanding. I could talk to you. You were understanding of each and everything. You knew exactly what was going on. And I was able to relate to you. And I said, who could be, and I remember as soon as Alicia set up the Facebook page, she's one of my former patients, and I will tell you there is no other better person than a former patient who, again, just like you, and we'll have her come here hopefully as a guest if she does so desire, so that she, just like you, Cheryl, again, very well versed, came out of state, left her family, her kids, and again, victimized by the breast implant illness, very nice, joyous family, and totally negatively and very harshly hit by this breast implant illness and a very nice bounce back. And what I hope to do is, hopefully I find this is an interesting way to engage a patient so that we can use this as a teaching tool. If there is any ideas, any suggestions by the other patients, or anything that we can make the system better, I always say, and I'm going to end with this. And Cheryl, if you have anything to say, please do so. But I will end this on my end. There are four groups of people in this entire phenomenon of breast implant illness. The first is the plastic surgeons. We need to recognize this entity, especially when it comes. We need to talk about it actively with our patients. I hate to say this, but this is a very much reality. When I first moved into my house, there was a neighbor. I just said, let me go say hi to my neighbor. And so the husband came and the nice lady, the wife was there. And they asked as to what I did. And I said, I am a plastic surgeon. And they're like, well, we were having plastic surgery in the next couple of weeks. We just came back from the plastic surgeon's office and she's going to get implants. And I said, you're almost at the verge of retiring. You're getting implants at this age. And they said, well, she got diagnosed with breast cancer. And so this is after the mastectomy part. We were, channeled into a room where the plastic surgeons were. We were sent for reconstruction and we were told it's safe. Then I said, and I heard and I questioned, the lady had a kidney transplant. And lo and behold, this group of plastic surgeons based out of Ann Arbor, a reputable group, was going to offer a transplant patient, a kidney transplant patient who is on tacrolimus or rapamune, I cannot remember which immunosuppressive agent, along with prednisone. She was going to be a recipient of bilateral implants, and I was surprised that she would be given that option to choose. And she said that she was told it's safe and that she will be able to accept, and it was, certainly a little higher risk than the average population, but she was a good candidate for reconstruction. And this is something that I find very troubling, where why on earth this would be offered to a transplant patient in her 60s. I remember they retired a couple of years later and they left for Wyoming. And what baffles my mind to this day is this is not a patient you should be offering implants to. So the first, to answer four groups of people that we're dealing with. Number one is the plastic surgeons. We need to be very cautious and we need to truly comprehend and we need to recognize this entity, breast implant illness, breast implant disease, whatever you call it. It is real. Cheryl is a real person with a family, with a job, and a productive part of society and life, like the tens of thousands and hundreds of thousands of ladies that exist. So we need to recognize what she's saying is real. We cannot just overlook and say, oh, she's 1 out of 10,000 and it's okay. No, this is a real problem. So the plastic surgeons have a responsibility to recognize this. Number two, the manufacturers have a responsibility to step up and say, just like the textured implants and like the regular saline implants and the silicone implants, that these are all come in with a set of problems. And just like we said earlier, it's not worth the risk versus the benefits. It's not worth the risk to put in implants that only last 10 years, that come with their own set of problems, that cause and affect literally, ultimately, each and every single patient. There's not a single patient who's going to get it in their 20s and not be affected in a positive way. There's only over time, it's going to be ultimately affecting the patient. So it's the manufacturer's responsibility, because they have the data, they manufacture it, they know what's going on. Number three, it is ultimately the administrative societies like the FDA, Lansing, the medical societies that need to step up and play a more of a regulatory role, where they need to be ahead of the game, where France, this May stepped up to the leadership role, and I wish it should have been the US who would have been the leader in the world to recognize that this breast implant illness is very real, and that the BII, breast implant illness associated anaplastic large cell lymphoma, is truly connected, affiliated, slash a result of the textured implants, and they should be banned. And so the U.S. has a regulatory role. The administrative societies, FDA, and the health department, where they need to step up and regulate and control. They need to control, the non-plastic surgeons who are putting in the implants, and they do not know more than half of the time what they're even doing. And these are the non-board certified plastic surgeons, like the emergency room docs right here in town in Detroit, ENT doctors, general practitioners, general surgeons, emergency room doctors, dermatologists. They are not plastic surgeons who are putting in implants. They need to regulate this market very carefully. And last but not least, the fourth group of a set of that needs to who can make the difference are uh, the patients themselves. And so the patients, as you can see, are the ones who are making the huge difference. So it's not the plastic surgeons, it's not the manufacturers, it's not the regulatory societies, and it is indeed the patients who are making and voicing and going on Facebook just like we are right now, and who are actively discussing and bringing it to the attention of the rest of the masses, not only in the US, but the rest of the world in South America, the Middle East, so that, a lady that I talked to in Japan who says, no, I know I have it 100%, and she's going to be explanting with me soon. The point being that the patients need to voice, we need to alarm, we need to create this information so that we can tell the primary care doctors, the rheumatologists, the endocrinologists, the pain specialists who are injecting patients in their back because the ladies are complaining of back and neck pain because of the result of the implants, or patients, the psychiatrists, who need to recognize that this indeed is a true disease. And I'll tell you, inevitably, it's only a matter of time before we come out in the masses, and I use the word we as in people who recognize breast implant illness, and say, you know what, we need to put an end to this because it's not worth it. And having said that, Cheryl, do you have any last minute, or any suggestions to make, or any comments? And I appreciate that what you did, that you, I'm sure, hopefully this will be passed on to a lot of patients, and that we will be able to share this. And, if we can, like I was saying earlier, prevent one implant from being inserted, or
Yep.
help another lady in another part of the world, be it in the US or anywhere, that the explant surgery is done right, we did our job today very well.
Right, absolutely. Well, I appreciate you having me on tonight. Just a couple of kind of final comments. My background is in healthcare. I've worked in healthcare for 25 years. So I kind of felt like I was a very well-informed consumer when I got implants. But again, the manufacturers and the FDA, we as consumers didn't have the information that we're about to be getting, to know how unsafe these devices are. Um, so, I kind of felt like even with my background, I still didn't have the information that I needed until recently. So I appreciate all that you have done to put videos out on YouTube to help us be educated about the different methods of implant removal, and why certain approaches are better than others. Um, and appreciate, I know I've talked to my husband before I did this live, to ask, what his opinion is. He never really wanted me to get implants, and I know he told you that when we were in the office. But he was very supportive when I had them. He was very supportive when he knew my mind was made up before I ever saw you in the office, that I was going to come to Michigan. I was going to have the implants removed. So he was very supportive through all the recovery. But he very much appreciated your attention to detail, to answer my questions, his questions, to really go over everything that we were going to expect from start to finish. Answering all my questions, when these implants, and I didn't know this when I got them, that capsule is going to adhere to the chest wall, which is so close to your heart, so close to your lungs, and how risky that can be when you're getting them, getting the implants removed, and just reassuring us, what the procedure is and what the process is, so that it put all of our minds at ease. And so thank you for all of the detail, and also for being available to answer questions, whether that's in the office and you're spending an hour with me in the office answering questions, or you're allowing us to contact you directly when we know we're going to have questions after we leave your office. And so I appreciated you saying that at the consult of you're going to drive home and you're going to think of a million things you didn't ask me. So here's the way to get a hold of me. So appreciated all of that, because you are such an advocate for us and for continuing our own education on breast implant illness.
No, I appreciate it. And this is, I'm sure, Cheryl, if you were me and I were you, you would do likewise, because that's, just
Absolutely.
like Alicia, just like Lori, just like my Jennifer, my front desk team
Mm-hmm.
player, she does a wonderful job. She gets, overwhelmed, meaning in a sense, there's so much information transfer. There are a lot of questions. This is a big deal, to do the
Yep.
surgery right. And we'll talk. What I want my patients to do, we'll come on again in another couple of weeks. We'll do this on Tuesday or like on a Monday. We'll set up a time, and a date, and I'll get another guest on. If my viewers or anyone for the matter, or if someone, it's a teenager, who wants to ask a question, I'll be more than happy to answer, because again, at the end of the day, we want to get this as truly as an informed consent. There are patients that have come to me and said that I've been to, my plastic surgeon told me that I was going to die with my initial set, and I was in my 20s, or they're very safe and they won't have any problems, which is absolutely incorrect. And so the best patient is the one who is the educated, informed patient. You were,
Mm-hmm.
and I will tell you, every single person who comes to me, I tell them each one of my patients has done the homework, and other patients, I direct them, I tell them, send the links, and hopefully we can make this an educational like a very informative educational experience for the patients, so that they know what and how to expect, and like you shared with your post-op, a recovery, the pain, and how you basically bounce back to your life, and you're back
Mm-hmm.
to your quality of life that each and
Mm-hmm.
every single patient deserves. So, having that, thank you very much. I appreciate everyone. Thanks again to Alicia. Thanks to Lori. Thanks to, I will thank Tracy Gary. She's always been there, for the Michigan group. At the end of the day, we're here to help whatever we can do. We want to make this a experience that hopefully after some time, everyone can say, and I'll end with this: there's only so much and so many of these surgeries that I can do, because there's only one of me. What I want to do is we want to alert the other docs, so that we can recognize this disease faster and better, and divert the patients to get the right surgery, just like this one patient ultimately did. He spent almost 8 9 weeks in the ICU. So with that, God bless everyone. Thank you again very much to everyone, and we'll see you back in a couple of weeks. Please ask the questions, and again, one last request: please talk and write your experience, because that's how we're going to make the difference. That fourth group that we talked about, the patients, they're the ones
Mm-hmm.
who will make this change, not anyone else.
Right. And if there's questions in the chat that we didn't get to that maybe were specific to my story, I'll kind of go back through those and try to answer afterwards, after it's posted.
All right. Take care. Good night,
All
everyone,
right.
and happy holidays. See
Thank
you in a
you.
couple of weeks. You're welcome. Bye bye.